News, Justin Bieber announcing that he's taking a break from performing for health reasons.
And the singer announced on Instagram that he is suffering from paralysis on one side of his face.
Just when you thought celebrities were superhumans, the Canadian pop singer Justin Bieber came out recently to announce that he was suffering from Ramsay Hunt Syndrome. And since you clicked on this video, I guess you'd like to know more about this very rare neurological disorder or disease which affects only 5 out of 100,000 people. It causes facial paralysis, and a person affected by Ramsay Hunt Syndrome tends to look like this. The 28-year-old Canadian singer demonstrated in the video that he could barely move one side of his face. You can see the signs of facial nerve paralysis in the video post, where we see Bieber is shown unable to move one side of his face. As you can see, this eye is not blinking, Bieber said. I can't smile on this side of my face. This nostril will not move. A few hours later, Bieber posted an Instagram story saying, "Been getting progressively harder to eat, which has been extremely frustrating. Please pray for me." All this has happened to him because of this rare disease which occurs when a shingles outbreak attacks and infects the 7th cranial nerve, also known as the facial nerve, in the head, close to one of the ears. According to the US Center for Disease Control and Prevention, the cause of Ramsay Hunt syndrome is the virus called varicella-zoster, and varicella-zoster is in the same family of viruses that causes chickenpox and monkeypox. This family of viruses is called the herpes virus group. Ramsay Hunt syndrome is also known as Ramsay Hunt syndrome herpes zoster oticus and is the second most common cause of facial paralysis or palsy. Ramsay Hunt syndrome is a very painful rash that occurs in what we call a dermatome, or a part of the skin that is supplied by the nerves in which the virus is reactivated in. Anyone who's had chickenpox can get it, but commonly, Ramsay Hunt syndrome affects people over the ages of 60 years, so those with advancing age and immunosuppression are more prone to it. And guess what? There are a few other Hollywood celebrities that have suffered from facial paralysis. Click this link above to see who. Statistically, 70% of cases of facial paralysis are due to Bell's palsy, which is another cause of faces getting paralyzed, and that's most cases. However, in about 5 to 18% of cases, facial palsy or paralysis is caused by Ramsay Hunt syndrome. The facial paralysis that you see in Ramsay Hunt syndrome is generally more severe than in Bell's palsy, and Bell's palsy, remember, is attributed to a different type of virus called the herpes simplex virus. What are the symptoms of Ramsay Hunt syndrome? Ramsay Hunt syndrome often causes a painful red rash of blisters filled with fluid in or around one ear, around the earlobe. In some cases, blisters also can show up in your mouth and your throat. Regular shingles also cause a blistery rash, but the bumps usually break out on a smallish strip on your torso instead of on your face. Due to the inner ear involvement, people with the condition can also suffer vertigo, which is a sensation of dizziness or things spinning around you. They can even suffer from tinnitus, which is a sort of ringing in the ear. Ramsay Hunt syndrome can also cause hearing loss on the side of the face affected. Like in Justin Bieber, it can also cause a facial weakness, a facial droop, or paralysis on the side of the face which has been attacked by the virus. That weakness can cause difficulty with closing one eye, making facial expressions and eating, as food can fall out of the side of the weakened mouth. How does Ramsay Hunt syndrome, how does this disease progress? The disease fully manifests in a matter of 2 to 3 days. Prompt treatment after diagnosis can speed up the recovery and reduce chances of severe nerve damage. Your doctor can usually diagnose it by asking you about your symptoms and doing an exam, but they may want to test a bit of fluid from a blister to confirm it. So, the diagnosis of Ramsay Hunt syndrome can be made by isolating and culturing the varicella-zoster virus from the vesicular fluid or by detecting viral DNA using PCR, which is the polymerase chain reaction. There are also other tests, for example, blood tests for varicella-zoster virus, electromyography, that is EMG, lumbar puncture in some cases, which are usually rare cases, magnetic resonance imaging, MRI of the head. A patient with Ramsay Hunt syndrome who has facial paralysis oftentimes has an enhancement of the nerve in the intratemporal portion of the facial nerve. What that means is that the portion of the facial nerve that's running through the bone of the skull is enhanced with this test. Also, nerve conduction tests to determine the amount of damage to the facial nerve, a spinal tap to test if other areas around the spinal cord have been affected. These are just some of the other tests you can have done. How is Ramsay Hunt syndrome treated? It is treated using antiviral drugs such as acyclovir or valacyclovir and steroids such as prednisolone to reduce inflammation. These two groups of drugs are the cornerstone of the treatment. However, treatment also consists of pain medication and physiotherapy. The patients are asked to undergo physiotherapy so that the movement of the affected part of the face is not severely restricted. Facial exercises are very important. Patients need to protect their eyes. When one eye doesn't close, there is a chance of developing corneal aberration. Patients must use eye drops or similar fluids to help keep their eyes lubricated and prevent corneal damage. Moisturizing gel lubricants are the key to preventing their eyes from drying and forming corneal ulcers. So, patients should use these teardrops and use eye protection. They should wear glasses when they go out and tape the eye that has been impacted. When they sleep at night, they should also wear eye patches which can help to keep that eye closed. Antihistamines can help with the vertigo symptoms such as dizziness or feeling like the room is spinning. For cases where there is prolonged inability to close the eye, some patients actually undergo surgery to put a gold weight on their upper eyelid that helps bring the eyelid down so that they can close their eyes. Hearing loss is common. On presentation, it affects about 50% of patients with Ramsay Hunt syndrome. Is Ramsay Hunt syndrome contagious? The disease is not contagious, but it can lead to chickenpox in those not vaccinated for the disease. But why is this? Well, the blisters have the live varicella-zoster virus in them. So, newborns, pregnant women and people who haven't had chickenpox or been vaccinated against it can get chickenpox from someone with Ramsay Hunt syndrome. So until their blister scabs fall off, these Ramsay Hunt syndrome patients are advised to avoid physical contact with these vulnerable people with low immunities who have not had chickenpox or are not vaccinated against it. Do patients recover fully from Ramsay Hunt syndrome? The take-home message is that Ramsay Hunt syndrome can be cured. As far as prognosis, although facial nerve recovery is generally worse in Ramsay Hunt syndrome compared to Bell's palsy, the good news is that total recovery or recovery with only slight sequelae is obtained in over about 80% of patients who receive antiviral therapy within the first 72 hours of Ramsay Hunt syndrome onset. So, generally, the disease is reversible. Patients can get cured within 15 days to 3 months of starting the treatment. Near complete resolution happens. Even the hearing loss is reversible. A little bit of residual facial palsy may remain though. There may be just a little bit of lag in the closure of the eye later on. What are the complications of Ramsay Hunt syndrome? These may include permanent hearing loss and facial weakness, eye damage, and post-herpetic neuralgia. Now, post-herpetic neuralgia is when a shingles infection damages the nerve fibers, causing some people to have a chronic lingering nerve pain in the region where the vesicles were, and this can also be quite debilitating. This chronic lingering nerve pain is usually treated with a medication called gabapentin. In rare cases, surgery is needed to ease pressure on the nerve in the face. Now, there are various other forms of treatments like acupuncture and electrical muscular stimulation to try and improve healing quickly. And I'm sure Justin Bieber has access to all of these non-traditional healing techniques. Prevention of Ramsay Hunt Syndrome. If you've never had chickenpox before, or you have small children who haven't been vaccinated for chickenpox, talk with your physician to see whether the chickenpox or varicella-zoster vaccine is the right thing for you. And if you're over 50 years and you've had chickenpox before, you may want to consider the shingles vaccine, because a shingles vaccine for people aged 50 and older is recommended, and children are now routinely vaccinated against chickenpox, greatly reducing the chances of infection. Prognosis of Ramsay Hunt Syndrome. So let's talk about Justin Bieber specifically now. Studies have shown that people who received treatment within the first 3 days of the diagnosis have recovered fully. Ramsay Hunt Syndrome can be graded 1 to grade 6 based on the increasing severity of the disorder. And based on the analysis of Justin Bieber's Instagram video, it does look like he has a house brachman facial paralysis scale 5 out of 6. So, he does seem to have a severe dysfunction of his right-sided facial nerve. He also has incomplete eye closure on full effort. He has asymmetry at rest of his brows. His right brow sits at a lower point than his left brow. So his chances of full resolution and complete recovery are at about, maybe 70 to 80%. However, these chances drop if his treatment was instituted after 3 days of onset. In that case, complete recovery chances could drop to about 50%, and if they waited a whole week to treat him, recovery would only be present in about just 30%, according to studies. So let's hope that Justin Bieber and his doctors began these treatments early. This condition can, of course, impact his ability to sing and to perform, because his facial muscles are paralyzed, and so the ability to properly sing may be affected. However, the factors that are in his favor are that he is under 50 years old, and he also started with what appears to be an incomplete paralysis, and that's a good, it's good for overall prognosis. And he also started with what appears to be an incomplete paralysis, and that's good for overall prognosis, given his access to world-class healthcare. So given all of this, he may have up to an 80 to 95% chance of complete facial recovery based on the current data. I'm Dr. Hadiza, your friendly, holistic reconstructive surgeon, and I hope you enjoyed this video. Click on this playlist to watch more.